Hi, I'm Dr. Joey Bennett from the Robert Boisonneau Oncology Institute alongside Wendy Hall, and I want to welcome you to another edition of Navigating Cancer. This is our third show that we've done thus far, and we've had some great feedback from you about the first couple of shows. We've had people give us suggestions, so please keep watching. Please keep giving us suggestions as often as you need to. We're very happy today to address something that has been very important to RBOI for many, many years, and that's not only the treatment of cancer, but the support of patients and their family members. And I'll let Wendy kind of explain to you our program today.
Well, we are so glad that Judy Bonnard is joining us, and I met Judy several years ago. We actually were in the studio,
That's right.
and she was doing a little talk for one of the other shows that was on in the community. And Judy has been, for years and years and years, devoted to breast cancer patients. And we're going to talk this first segment about the support group and all about that, but we really want to thank you for coming on the show.
Well, thank you for asking me.
And we
I'm
love your
happy to be here.
pins, your
Thank you.
earrings. I don't know how you can catch,
all
but
set.
she's all set. Yes.
Always.
Tell us a little bit about the support group and how you got started and interested in pursuing that.
Okay. I was diagnosed in 2006 with breast cancer, and that was by a digital mammography being done. I went through all treatments of chemo, radiation, and a dear friend of mine asked me to join her support group, and I did, and I really got a lot out of the support group because what women face psychologically and physically are two different things. And psychological, what they're going through, nobody can understand unless you have been in the shoes.
And it's so overwhelming.
It really is. A lady, a woman, whether it's a man, a woman, there are 4 words you don't want to hear, and that's, you have breast cancer. Mm-hmm. And women as well as men both can get breast cancer. So at the time I joined the support group, we had about 7 ladies, 7 to 8 ladies in there. And I really got a lot out of the group. We meet in a wonderful place and very homey. RBOI is a very welcoming home place to be for
And that's our
breast
office.
cancer.
She's talking
That's
about
right.
our office.
That's right. The lady that ran it, evidently, I mean, at that time she got ill, and they asked me if I'd take it over, and I said immediately yes, because I didn't want to leave everyone just sitting there with no support. Mm-hmm. Since then, I have been doing this for 4 years, and I'm going to be 5 years as a breast cancer survivor in December. In the 4 years, we have approximately, if I go down the list, over 30 women in this support group. Not all 30, sometimes attend. We have an attendance of 15 to 18. I tell any lady out there, if you're facing breast cancer, being diagnosed, need to be with people that understand what you're going through, please come to our support group. We meet the second Friday of every month. We do not skip a month. It's the second Friday at 11:30. We have a light lunch. And I sometimes have speakers every other month. And these speakers are dealing with nutrition, pharmacists. We've had, with different cancers, people that have had breast cancer, they may have another type of cancer. I don't say no to them, they can't come. They come and they feel much better after they leave. A lot of them walk in the door with tears and fears. Mm-hmm. And I greet them with a hug and with a smile, and by the time they leave my meeting, they are in good spirits and they have a great attitude. I tell them attitude is what it's all about, and humor is the best medicine you can have. And we close our meetings with humor and leave them laughing walking out the door. Our meetings are usually over with between 1 and 1:30, so it's not a long day to be with us. These women discuss their problems that they're going through, hair loss, be it a soreness. I've been there, I've done it. So I try to help. No, I don't have medical answers. That's why I say, please ask your doctors. Don't be afraid to ask your doctor. They're wonderful women. I love what I do. I'm very fortunate, and I think the ladies know they're very fortunate that they have a place to go to have a support meeting. Because out of this state, there are many states that don't have support meetings for those women. And I'm very much for this.
Yeah, that would be shocking because is it true that about 1 in 8 women have breast cancer?
I mean, if you look statistically, about 1 out of 8 women will develop breast cancer in their lifetime. And to Judy's credit, I will tell you this, that the other support group that we run in our office is the Prostate Cancer Support Group. And we used to have a much larger crowd for the boys' meeting than for the girls' meeting. And since she took this thing over, we're dragging behind now. And it is single-handedly because of Judy, the work that she has put into it. These support groups not only give women an opportunity to come and meet with other women who have had cancer and to hear speakers, but there are friendships that are formed, and Judy can speak to this as well as anybody. There are truly friendships that are made. You look forward to seeing each other every month at this meeting. When someone is having a medical problem, they're there for each other. Judy emails me about patients when they contact her. When I have someone that I think needs help, I'll call Judy. I mean, I have literally called her at 8:30 in the morning, and she's come to the office by 9 o'clock to see someone. And so the success of the support group, the success of the other programs we're going to talk about later on in the show are all basically due to you, and you've done a tremendous job. And
Thank
when
you.
you walk into that room and you see the ladies having fun, they're having salads, they eat healthy, they have a good time, they communicate with each other. Some bring their spouses, some don't. But it really is a great environment for women to share their experiences. And like Judy said, no one can tell you what it's like to be a cancer patient until you've walked in your shoes as a
That's
cancer
right.
patient. I see
That's right.
patients all the time. I know what they're going to go through, but I internally don't know what it feels like. And that's where having someone that has been through it plays such a vital role.
And not only that, Judy does email, sends out a newsletter. I mean, she goes above and beyond, and so we, sincerely want to thank you for that. I also wanted to say that the next meeting will be this week, so it'll be November 11th. So everybody that's listening, and you are welcome to come. They do not need to call ahead or anything, do they?
No, they can walk right in. Anybody can walk in. They are a breast cancer, going through treatment, just been diagnosed. Please come, we can help you. And that is this month. I want to tell you that my ladies also, they make up baskets for Relay, for RBOI. And we have a Thanksgiving
for Life,
basket,
yeah.
and we have a Christmas basket. They donate all these things, and they love doing it. These ladies and myself say this is what we call giving back, and they give to the food pantry. They will do whatever I ask. And when I say friendships, these ladies have been with me since I started the support group. I want to tell you that their newsletter is ready even for Christmas, and Christmas is going to be called Christmas at RBOI, and that's going to be an upbeat, lifting program with entertaining.
We're going to come right back.
We'll be right back, and we'll cover more of this after we're done.